Electronic health records is basically a long-term storage of the health data of patients or of a community. This information system can be conveniently shared with different healthcare places, such as primary care physicians, hospitals, and insurance companies. In general, this can help healthcare providers be more efficient and give better quality of care. However, there is a concern that storing health data of patients and sharing them with different health providers can decrease patient privacy. The fact that multiple providers can edit this information may lead to miscommunication between different health providers. Overall, the long-term collection of health information of individual patients and communities have both the advantages of convenience and efficiency, but also the disadvantages of the lack of privacy and possible miscommunication.
As discussed in this week's assigned paper, EHR is comprised of many different components, with the first being administrative system components, which helps with the registration, admissions, and discharge and transfer processes in a hospital. In the hospital that I volunteer at, transfer process could be easily done by checking a box in a computer, which alerts the transfer unit, and they're able to take a patient from telemetry to cath lab in such an efficient manner. The second system is laboratory system components, and this makes sure that lab orders are integrated properly, scheduled, and that all results are in the same spot. The next is radiology system components, which integrates patients' radiology data and images all in one spot. This is something I look forward to seeing in the future because in an old hospital I volunteered at, instead of having all these images localized in one spot, there was a radiology section of the hospital that had many different images filed away or discs stored away. So when a patient came asking for their information, we'd have to dig through and find it, get that disc, make a copy, and it was a very inefficient manner of doing things. The fourth is pharmacy system control component, which includes machines that can distribute and fill prescriptions on the spot. And the fifth is computerized physician order entry, or CPOE, which allows doctors to order lab, pharmacy, and radiology services all in one spot. In the other reading that we had assigned this week, we saw that while CPOE is getting better, it still is missing many fatal medical errors and not alerting physicians of when there's potentially harmful medical errors that could happen.
Hello there, my name is Hannah. So EHRs may include a whole range of data in comprehensive or summary form, including demographics, medical history, medication and allergies, immunization status, lab test results, radiology images, and billing information. This enables the admin to retrieve data for billing, the physician to see trends in treatment effectiveness, a nurse to report adverse reactions, and a researcher to analyze the efficacy of medications in patients with comorbidities. Most commercial EHR systems are designed to combine data from some ancillary departments with various clinical care components. Some systems also allow for electronic capture, but often not integration of physiological signals, nursing notes, physician orders, and so on. The system could also resolve ambiguities in terms of vocabulary by using a structured vocabulary system and capturing the data in a compatible way so it is recognizable. An EHR may also facilitate the sharing of records across systems, albeit with the file owner's permission. And developments in electronic health records also allow for long-term preservation and storage for records.
Every technological innovation, there's always some kinks to it. Let's talk about
The issue is that too many alerts are sent out, but even though a multitude of alerts are sent out, they are still unnecessary for patients and doctors to view. This could lead for a patient and doctors to become immune to the significance of these alerts. So one possible way that we could possibly tackle this issue would be to create a spectrum of urgency for each alert. That way they don't become so immune to paying attention or just dismissing these alerts. CPOE systems have been utilized to place medication orders. They have been more efficient in keeping medical orders updated. However, they require innovation due to the fact that these systems have previously failed to send alerts of harmful and fatal drug orders. It might be best to suggest that hospitals and IT officials look over these systems and ensure that they are updated with the correct and current medical information. More communication needs to happen between these two groups.
Hi, it's Chris. Today I'm talking about the long-term storage of electronic health records. It seems like once once their assets get digitized, this issue always comes up. But it's always after the fact, after everyone has bought into digitizing data, but not before. Similar to the television industry and the music industry, when the TV industry decided to stop using tape and only send files to networks, there was a panic of how will we store all these shows long term. This happened at a company I worked for in LA that did business with Disney. They're still dealing with these issues. They still haven't figured it out. The same thing happened with electronic records. We need to take a long-term view on this issue. There needs to be some kind of standardized format for EHR. It seems like everyone has maybe a little system that's a little bit different, not necessarily that they talk to each other. But this format, or this electronic format, is actually in its infancy. But data structures and media management are now an important part of our healthcare system, and we need to plan for it. Thanks.